Great. Well, that was actually a brilliant explanation of something that I think a lot of clinicians find very confusing, coagulation. So thank you for that. And we're going to move on now, if we can, to vitamin D. Again, lots can be said about vitamin D, but let's just kind of keep this conversation really clinically acute. So vitamin D deficiency is now clearly linked to both the risk of developing cancer and cancer progression.
Yes.
So I'm curious about your thoughts about why there's that linkage, number one, and number two, what you look for in somebody's serum vitamin D levels.
Certainly. Well, think about the functions of vitamin D. We now understand it as a hormone, right?
Mm-hmm. Right.
And so it has a multiplicity of actions. One of the things is it changes the endothelium. And the initiating factor for coagulation, for example, is damage to the endothelium. So that is a possible link. But vitamin D also affects cell adhesion. Very, very important in whether or not cancer can metastasize and progress. So we have something that keeps cell adhesion normal and keeps the stroma from being able to be invaded, then we have something that will really prevent the disease from traveling.
Right.
We want to look for things like that. But vitamin D is an immune modulator also. And vitamin D, because of its impact on bone, may prevent metastatic invasion of the bone. So we don't know all these things. A lot of this is hypothetical, but our empirical evidence is that people who have lower vitamin Ds definitely have higher incidence of cancers. We have good data with breast cancer, colon cancer, and lung cancer. But there are some studies that show lymphomas are also affected by vitamin D, and gastric cancers, pancreatic cancer. I think if we had enough studies, we'd see that it affected
I think so too, yeah.
a lot of
All
them.
of them, pretty much.